registering more people than most states, particularly when you think about the fact that we don't have a state exchange, which is a crime. And it's a, by the way, it's a crime even if you're a Republican. $51 billion of our taxpayers are going to the Socialist Republic of California, to the Liberal Alliance of New York, so that their healthcare system will work, while we're turning away people who could easily qualify for healthcare here in the United States, and in particular here in Florida, and it's creating a huge gap. So I want to thank you for coming in and doing the work, those of you who are volunteering. I know we've got a group that's helping with Dreamers and signing them up. That's also tremendously important. These are two areas where I think we're, as a nation, we need to take a step forward. I think without question, healthcare reform, ACA, did the right thing. And is it perfect? Of course not. And there's a lot of things that we have to fix. But it's the most powerful nation in the world. Healthcare should be a right and not a privilege. And likewise on immigration. You know, when you look at our country's history, if there is something that America has done better than any other country in the world, is make Americans. It is probably one of the defining attributes of our culture, that every time it appears that we have exhausted that American ingenuity and capacity, we find it again in the renewal that immigrants bring us. You know, as a congressman, I get to go to the swearing-in ceremonies, and Caitlin, my chief of staff, tries to put as many on my calendar because it renovates me, right? I did one on Friday where we had about 100 some odd people become citizens, and it's wonderful to see the diversity, and that diversity adds to our community, adds to what we do as a country. You know, I always tell the story. I was debating a Republican, and he said to me, "Well, Joe, what do you do if somebody broke into your house? I mean, what do you think should be done? You don't think they should be arrested?" I said, "Well, it depends. If somebody broke into my house to take care of my kids, to take care of my grandmother, to fill my refrigerator with fresh fruit and vegetables, and then to go outside and mow the lawn, I think I might owe them money." And in the bright context that is our country, these people are an economic engine, which we are underutilizing, and of course it is hurting the whole economy. You know, if you don't think about the human costs, right? 2 million families broken up in the last 4 years. Think about the economic costs. Right? We know that over 20 years, $800 billion of new revenue to the country. We know for a fact that when you find a pathway forward, salaries of working class American and middle class Americans go up. We know, for example, that 50% of our Fortune 500 companies, 50% were started by an immigrant, or the son of an immigrant, or the daughter of an immigrant. And so these are things that, let's forget the human side, right? As Democrats, they say we lead with our heart. So let's forget that. Let's look at the business side. And we are giving up this business opportunity, and of course this uniqueness about us. You know, it's sometimes when you listen to people talk about our country, they get all worried about America and what we're going to become. And of course, what America is always becoming, always evolving, always being the next thing. And that next thing is brought to us with the hopes and dreams of people who aspire to immigrate. Likewise, you know, I didn't pass Obamacare, right? I didn't pass the ACA, but I support it. I support it because it's something that changes people's lives. You know, my staff was going through some of the people that we had, and we had some great stories. They wanted me to memorize this, but I thought they were so good that I want to tell you about them. You know, I'll tell you first off, you know, you've probably seen the commercials that are running against me in the district, and if you listen to Pandora, you get to listen to it also, or watch it. And my mom says I look good in the picture, so it's okay. But there's not a day that goes by that someone doesn't come up to me at a restaurant, at a stop, when I'm speaking, and they reach out and they touch my hand. They say thank you. They say thank you because this is making a difference. And so 1 out of 3 people in my district don't have health care. 1 out of 3 people. Think about that. And of course, if you have health care, that's wonderful, but if you have health care for your children, they're going to school with children who do not. That has impact. If people are sick, they can't be as productive. And so these are important things. You know, I represent a particularly unique congressional district because I represent this area, which is known as the FIU area in Westchester. I represent Kendall, the Redlands. I represent the area of Richmond Heights, and then all of the area of Gould, Naranja, and then finally Homestead and Florida City, and all the Keys. So I've got rural areas, I've got urban suburbs, I've got suburbs, and then I've got resort area, which is the Keys. And each one of those areas has all sorts of problems, particularly because of healthcare. And that's why healthcare reform is so important. I was at an event a few months ago, and a guy walked up to me, and it was fascinating. You know, he was clad in it was a party in the community there in Key West, and the party was pretty out there. And he walked up to me, and he was clad in leather, and he went up to me and he said, "Listen, I want to tell you something. I have AIDS, and I have 3 jobs. 2 of them are just to pay for my health care. 2 jobs just to pay for my health care." And he said, "I just got ACA. My health care coverage went down from $900 a month to $250 a month." That makes a difference. Talk about a guy, William, also from Key West, who'd been living without health insurance, got cancer, ran out of all his personal money. And now, because of health care, he's able to get assistance, he's got a doctor, he's going through his treatments. Marcus, personal trainer. Here's a guy who's engaged in the act of being healthy, right? And so Marcus had always had health care, but of course, every year, all of you know that have employer health care, every year it goes up. And of course, every year your employer charges you a little bit more or charges you a lot more because they don't want to pay for it. And their health care at their business had gone up to $900 a month. This is a guy who's healthy, right? He does exercise for a living, he's a personal trainer. Now he's got a platinum plan for $300 a month because of the small business incentives that the government put in place so that his employer could get health care. A guy, Michael, who just moved here from Ohio. Here's a guy who had a bad hip. He had never been able to take care of it because he didn't have health care, and his boat capsized when he was fishing. He's a fisherman. And he fishes for a living, not that he was out in his pleasure boat when he should have had health care. Flipped when he was working, and he couldn't walk anymore because he got health care. He now walks again. He's getting back to work in a few weeks. These are the kind of things that we see on a daily basis. And there's a great quote by Bentham, Jeremy Bentham, which said, "A society should not be judged on how its most powerful live, but how its weakest are treated." Healthcare is that point in everyone's life. It is that meaningful thing to think about going to bed and not being able to take care of a loved one. I've had it happen in my life. I've had someone very sick, and we had great health care. People talk about choices in healthcare. I don't know if you've ever had that experience when a doctor says to you, "You need to do this." It doesn't matter what it costs. It's a human life. You do it. That's not choice. You're in an impossible position precisely because it is the most precious thing that we have as humans. So I thank you for those of you who are signing up. More importantly, those who are signing other people up. I thank you. We expected a lot more advertising, and I think it's unfortunate that there isn't. But I think you see with the enrollment numbers that we're going to hit pretty close to the mark where we're at. And then on a final note, you look at places who've done this. If you look at the ACA and you compare it to something else, well, the best example is Governor Romney's plan in Massachusetts. And Governor Romney's plan is, in essence, a mirror of what we've done in Florida. In that state, with the exception of states that have had huge natural resources expansions, this doesn't cost jobs. In fact, it attracts better people. It attracts more people. It makes people more productive. So I'm all in. Are there things we have to fix? Absolutely. But but long-term, this is something that's good, and, you know, Alan, thank you for doing this, thank you for getting people out here, and each of you, spread the word, because part of the thing is, you create this culture of fear, right? The website doesn't work, you know, and you're right, it didn't work. But it now works, and if it still doesn't work, you've got to try, but the reality is you shouldn't try because you're scared it's not going to work. These navigators are doing a wonderful job, and you'll get there. And it feels good to have that safety net, and it feels good. And as a nation, I think long-term, we're going to see not only the benefits in productivity, but we've already seen the first benefit. For the first time in over a decade, the cost curve stopped. The 8 and 9 and 10% minimum increases on a yearly basis over the last decade stopped. That's amazing. By the way, at that clip, 8% a year, that means you double twice every decade as a conservative number. And we were able to bend that curve. And by bending that curve, we've also, with healthcare, saved Medicare, which is what people don't realize by having this. And what we also don't realize is that long-term, all the resources, we're still spending the same, I want you to understand, we're spending the same amount of money. Problem is now we're not spending it in an emergency room. When somebody has a hangnail that's gotten infected, they shouldn't be walking into Jackson Memorial's emergency room because they don't have health care. That costs $20 and 2 minutes of a doctor's time. But when you walk into Jackson Memorial Hospital, an hour of a physician's time, that equipment, it's $5,000, $6,000 an hour. By the way, we're all paying for it. We're paying for it in our taxes, both state, federal, and national. Now we can spend the money exactly how it has to be spent in a more efficient way. But if you look at our health, if you look at American healthcare, we spend 18% of our gross domestic product on healthcare. I want you to understand, our next closest industrialized competitor spends 12%. So we are spending 50% more, and our outcomes aren't as good. Now, maybe we should spend 18%. I'm not against money. I don't want to cut into anyone's pie here. But what I do know is if I'm spending more, I better get better. I better get better service, and that's what we're not getting. And yes, we have one of the great healthcare systems in the history of the world, but it's not the best in a lot of areas, and we can make it better, and that's what we do in our country, right? We aspire to the best. So I've gone way too long, but thank you. I don't know if some of you had some questions. I'd love to take them if you do.
Bueno, en mi caso quería agradecerte porque mi mamá es residente y había estado tratando de aplicar a su cobertura de salud y no lo habíamos podido lograr porque pues yo tengo mi propia familia y no la puedo incluir en mi aseguranza. Así que fue muy bueno ver los resultados. Está bien, tuvimos un poquito de inconvenientes con el website que adicionalmente creo que es normal. Estamos en un proceso de aprender a manejar.
Correcto.
Y tiene un tax credit de 405 equivalente a 4.860 anuales, que va a ser una gran ayuda para mi esposo y para mí, la salud de mi mamá.
So déjame traducir un poco, because some of you may not speak Spanish. She was talking about her mother's health care, right? And they applied. It was difficult to get on the website. She got a $4,500 a tax credit, which brings it to a more reasonable level that they can deal with. And so she was saying thank you. But I want you to understand when you look at this, because this is, I'm sure your navigators get this all the time. Somebody will say, well, you know, I had health care. You know, there'll be someone my age, right? They'll say, I had health care and I was paying $47 a month. I said, well, I'm sorry, there is no health care. Not a health care that actually takes care of you. There are phony health care plans. But there's not a health care that provides a yearly checkup, that provides free mammograms, that provides birth control if you need it, for $47 a month. Right? This just doesn't exist. And the reality is that when people look at what they had and what they have today, a final thing on that issue, 70% of American bankruptcy, 70% of American bankruptcies aren't that you tried to create a business and it failed, aren't that you spent too much money on your credit card because you're irresponsible, they're because you got sick and couldn't afford it. We're going to change that equation we're gonna keep more money in people's pockets, that way making more people more productive, and make our country better for it, so. Okay. Any other questions? Because I can go forever. Yeah.
Just to follow up on that point you just made, that 70% of bankruptcies due to medical bills, most of those people were insured, but they had the crappy insurance.
That's exactly
People
right.
are now complaining about being taken away.
Well, one of the folks I talked about, right, you know, they have healthcare, right, but what do you do when a child gets sick and they reach their lifetime limit? And of course, you're gonna spend whatever it takes, and there comes a point where you don't have any more, and they take it all. And that is precisely the issue here. And I think, you know, it's fine that we have a national debate about this. I'm fine with this. I think this is a good debate. These are the things we should be talking about. These are the things that have meaning in everybody's life every single day. It makes the floor on employment and jobs and productivity better, and it makes the rest of us better. And in the days and the weeks to come, if this is where people want to have a debate, I'm very comfortable. My conscience is clear. It's a good place to have a debate.
What can the citizens do or continue to do here in Florida to push the legislature here to pass Medicaid expansion?
Well, I mean, the perfect example is your state representative here is against it, right? And you've got to force it. And, I mean, think about that. $51 billion. It's not 51 million of deficit dollars, right? That's funny money. No, this is real money that we pay in that now we're not going to get. So, and of course, in Florida, the number changes. I heard it was 1.3 million, oh, that's a good number then. 1.3 million people that would have had health care are lost in this process. And it's just irresponsible. It's irresponsible. The truth is, you know, it's a fascinating thing. I have had an argument with some hospitals that came to see me. They said, well, we still want to get that money. Can you go around the governor? Because we still have to treat these people. And of course, I want the hospitals to stay strong. I want them to be able to take care of people. But where's the fight? Where's the outrage? Why fear something that's wrong? And, you know, the governor said, oh, I'm for it, and then he was against it. You know, the governor, the speaker of the legislature, Mr. Weddle, his own brother was on Medicaid. His own brother was on Medicaid. And somehow Medicaid is back. You know, we have a unique opportunity because it's a good debate. It's the right debate. We're on the right side of history. And that's one of the things that we don't realize is to tell your neighbors. Because they, you know, someone your age, right? At your age, I'm in politics, so I'm still crazy, but at your age, you in your mind, you're indestructible, right? Nothing can happen to you. And there's a very good chance that nothing will happen to you. And so the idea is, but when it does, we all end up paying for it, right? And the cost of healthcare for someone your age is phenomenally affordable. But the fact that women, for example, pay more.
I had a parents, and I was pregnant, and I started all my papers to get my Medicaid, and they start asking me for papers. You need to send this, you need to send that. Finally, and I was scared to go to see my doctor because it's an expensive doctor. Every time I have to go, maybe I have to pay like almost $300 per visit to doctor, and you have to go when you're pregnant. You have to go constantly to the doctor. Well, I never get my Medicaid. I just lost my babies. I was expecting for twins, and I lost my baby because I was scared to go to see my doctor. And I don't have any reason to go to the emergency room because finally I went to the emergency room because I get the flu. That's why they find out I lost my babies. Yeah. Just waiting for a Medicare.
And it's, you know, it's a horrible thing. But think about the incentive we send to a society. That we said men have to pay less because they don't have children. Children are a blessing. They're a necessity for tomorrow, right? And the idea that we would de-incentivize employers from hiring females because females cost more because they can get pregnant. The ridiculous debate about that Rush Limbaugh wanted to engage in about birth control. These are absurd things, right? A young man should pay the same as a young woman because the product and the productivity of that child ascribes to us all as a country. But when we do that, we put you at risk, we put our society at risk, we put the future at risk. And these are the incentives that we've been living with for a long time. You know, I'll make a final point on this. It's fascinating to watch people today speak well of their insurance. I've never heard people say something good about their insurance company until we got Obamacare, right? Suddenly, they love their old insurance, right? But until we had an option, they wanted their bad insurance. But it was bad to the moment that the president created this thing. And it's absurd. And in the end, look, the insurance companies want it, our hospitals need it, our society is going to be better for it. And by the way, 3-4 years down the road, we're going to be able to see the great benefit socially we're going to get from this, so that we understand inputs and how we treat people, because it's not always about treating sickness, right? Which is how we do it now, but it's how we treating things in a preventative way, right? When we look at how we can do programs that strengthen nutrition in schools, programs that incentivize people to eat healthy and eat locally and eat fresh, because we know if we do that. The last debate on food stamps, it's that when you cut food stamps, people consume more corn syrup, cornstarch products, so their diabetes rates go up, which we pay for on the other side.
Yeah.
We're all going to pay for this, so better pay it in a smart way. And I think we've done something important, and we're going to fix it and make it better. Yes, ma'am. And we'll come this way. Yeah.
Oh, I have a question, seeing all the moms for the DREAM Act here, because I have my nephew, he's 16 years old, and he was, he came to this country from Venezuela when he was 2 years old. Anyways, but now he has his employment authorization. Now, he's got, right now at his high school, they told the mom that he needs to take like a speech therapy, because he has some different, it's like, yeah, he hesitates to, anyway, so the therapists are, with that insurance, of course, I already find out for her, it's very expensive. Now, the requirement to be in the Affordable Care Act is you need to be a resident.
Yeah.
What are the expectations for this big, huge, amount of, youth that are, to
Look,
get there, to get to be residents, and then from there, be able to apply?
Look, I'm the lead sponsor of the immigration bill in the House. And it's not a perfect bill, but it's better than what we have and where we are, and it gives us a pathway forward. The challenge is that the Republican Party in the House just simply can't find its way on this. And the president, for the last few weeks, has sort of taken the pressure off, hoping that they'll move forward. I'm an optimist. I believe we're going to get a health care reform before the end of the year, maybe in the lame duck Congress after the elections, maybe right before the elections. But that's exactly right. I mean, in the end, it's funny, we don't let these folks join ACA, right? But all the folks that are here without documents pay into phony Social Security accounts, which balance the Social Security system, right? Our surplus in Social Security is kept by these very people in our system. And of course, when you add their tax revenue into this, it would, of course, all this washes out. And it's another fascinating thing. You know that the least amount of users of the healthcare system are the undocumented people, right? So, and by the way, a lot of reasons has to do with the fact that they're healthy, right? They do manual labor, so they're healthier than other Americans. Some of them are outside, so they're healthier than other Americans. But the reality is that this is, again, a false premise in the debate, which unfortunately became part of the outcome of what we say.
Congressman?
Yes, sir.
I just want to, back to the point on Medicaid, I just noticed these flyers are here, and there's the phone number to call your state representatives to urge them to pass some form of Medicaid expansion. I
So
just saw that.
$51 billion, 1.3 million people would go on. Yes, sir.
Are you for the public option or ACA?
I'm for ACA because it's what we have. Do I think that if we would have just gone to a Medicare for all, it might have worked? It works for people. So I'll give you the story of my father, right? My father my father's a small businessman, and my father was, he and my mom worked together. And my mom is a little bit older than my dad. And they were paying, so she retired and went on Medicare first. So she went on Medicare first. And then my dad was paying $2,400 a month. That was his health care. It was 64, 63. And it's just, it's impossible, right? It's, you know, unless you're very wealthy. And people understand Medicare. By the way, businesses do, I mean, you see them, the clinics for our elderly, you know, that they like going to, and they say, you know, these people are so nice, they call me at the end of the month to see if I took my medicines. You know what they call? Because if they keep you alive and healthy, they make money, right? So they have an incentive to keep you alive. They love you because they see money when they look at you.
And Joe, excuse me, not to interrupt you, that's another facet of Obamacare.
Of course. So
That
a
was
doctor
never
today,
present
yeah,
before.
a doctor today, before Obamacare, a doctor got paid for cutting your foot off in diabetes, but wouldn't get paid to keep your diabetes in check. Now, they get paid. But, you know, the fantastic argument on the other side of Obamacare, the last fallacious argument that they gave 2 weeks ago about the fact that we would lose 2 million Americans because they would be pushed out. Let me explain what it was. It was my father's story. My father wanted to retire or work less, but he had to work to pay for his health care. And what this said basically is, if let's say you've worked your whole life and you've saved a nice little nest egg. You're 60 years old and you've got in your retirement $1 million. Well, on Obamacare, you can say, all right, well, I'm working, I no longer enjoy my work, it's no longer challenging, but I've got to work for this health care. What the CBO report said, these are people who would rather pay for their own health care and go home and be with their wife or with their family or enjoy it because they've worked very hard. But if he's holding $1 million and he gets sick without health care, so this is, look, we're going to win this argument. We're going to win this argument. This is the right argument. But it's going to take a while. And there are going to be things that don't work. And, you know, I voted on, I don't know how many fixed issues already, but a ton of them. Because I do think there are little things that we can keep doing to make this work better. That the website didn't work is inexcusable. But, you know, things happen. This is the largest thing we've ever done. It took to get Social Security to work something like 6 or 7 years. Medicare Part D, which Bush did, took over a year just to get, and that's like a little tiny thing. So it takes a while. This is a very complicated, huge thing. But think about this form, right? If you're my age, you know, when I did my insurance, at my last job before I got elected to Congress, it was 20 pages. You know, have you ever had a headache? Have you ever stubbed a toe? Have you ever had high blood pressure? Have you had low blood pressure? Have you ever taken this drug? And of course, all those questions are simply meant so that the moment you get sick, they say, well, look, you showed here that you had once stubbed your toe. Therefore, we can't, you're not covered. All right? Thank you.
Well, thank you so much for coming and taking the time to speak with us. Just wanted to give you a couple of the organizations that are here and helping with the efforts. So we have Planned Parenthood, who's here. We have also the Latina Institute for Health. Yeah. I'm sorry, I know it's so long. That was for you. We have the Florida Legal Services, of course, the Epilepsy Foundation, and Anthony. Could you repeat? Great. And yeah, this is actually
for working families.
thanks, Kit, and of course the Miami-Dade Young Democrats as well. And this is actually an event that's going on in 3 different places around Miami. We continue to do that until the end of the enrollment. So we want to thank you for your continuous support and to continue, please, being that strong voice that we need up there.
We're going to try. We're going to try.
in DC.
So Caitlin is our chief of staff, and she works out of our Washington office. Kyle works here in our Dade office in Kendall, Westchester area. And if you ever need anything, our office is on
28th and Bird.
128th and Bird. And and it's on the second story there. Come see us or just call us. And but thank you for doing this. You know, listen, it's a beautiful day out there. There's a lot better things to do than sit inside. But you're changing people's lives. You're making their lives better. You're making our country better. Don't let anybody. This is Americans thinking about each other is what makes our country better than others. So thanks again.
Thank you.
Thank you.